Hello. How's everyone doing? Happy Thursday night. So let's see, let's jump into this. I have a bunch of things to update you guys on. It's been a while. But let's start with some of these questions and then I'll update you as we go along. So does Justin Bieber doing a hair transplant nowadays? So did Justin Bieber have a hair transplant? I don't think so, based on what I've been seeing recently, but we'll have to reevaluate that as he reemerges from hiding out, and we'll see. How to prevent ugly scarring after surgery when one has a skin type prone to hypertrophic scars. So, yeah, I mean, it's tough, right? Especially with cosmetic surgery because you're going in and, if you already know that you're prone to hypertrophic scars and you're going to get a scar from the surgery and, should you do it in the first place? I think is a question that should come to mind. But if you decide to still go through with it, one thing to consider telling your surgeon is to consider injecting steroid. My daughter, by the way, is sleeping next door, so I'm gonna keep my voice down a little bit, so hopefully you guys can still hear. But you can inject steroids sometimes as you're closing up the incision, and that can sometimes prevent some degree of hypertrophic scars, but then you have to, of course, stay up on it and, monitor the wound and really make sure that things are, progressing nicely. Scar gel can sometimes help, though. Listen, some people just have these predispositions, to thick scars. Um, Lorraine Black, nice to meet you. Thank you for being here. Hi, Marcel. I think we've seen you here before. Thanks for joining again. Thank you, KNAS. All right, so we're getting people into this chat now. So I'll come back to the questions, but it's fun to see people posting all this. But one of the reasons we wanted to do this chat is to, of course, update you guys on what's going on because a lot's going on, and it's like, oh, actually, I just forgot one more thing. I'm going to add to my list here about the new space. So yeah, lots of things going on here. All right, let's get into it. So the first, and then we'll come back to these questions. So you guys can keep writing them out, but I'll have to scroll back up. It's a lot to keep track of. Newsletter. So we have a hair specific newsletter called Hairlines. Um, Clever, I know. And so that is in the description, or at least Marco said he's going to post it in the description of, I guess, this video once it's maybe published. And so you go ahead and, oh, he just put it there. You guys can see hairlinesnews.com. So it's a hair information focused newsletter. It comes out every Monday. We email you guys, and we don't just put anyone on the newsletter. Thread. So basically, only if you want to receive these emails will you be getting them. We don't believe in spamming people's inboxes. And it's just once a week, and it's more or less a summary of our prior videos, but we also add in some Q&A as well to that as like bonus material. And so it's free. It's just like we just want to give out the information that we make videos out of, but in a different style that might be easier to digest for some. Not everyone has time to watch the long form videos, so this way you get a concise version of it. So sign up for that if you aren't signed up already. Next thing is we're working on a hair app. So it's like a hair restoration type of app, and it's built around this like AI machine learning capability to predict hair transplant results. So we had people actually from our community on YouTube beta test some of the early algorithms for it and really helped us with feedback. And we then modified it, adjusted it, improved it. Uh, Now we have a guy who is helping us build an app around that. We're trying to create like a hair transplant community and just make it easier to reach out to clinics. Because some of you guys ask me like, "Oh, I'm located in wherever Brussels. How do I, find a hair clinic around me?" So we're gonna try to point you to the right place if you guys don't want to be all coming to me, which of course we have a weight that's building up, which is great, but I can't obviously treat everybody. So there are some fantastic hair surgeons out there as well. So we want to put people into the right clinics, point them in the right direction, and also give them a sense of how their transplant might look, and start to build a community around that. So that I think it will be fun. Next thing is products. So we have a scar gel that just completed its testing for any kind of hypersensitivity, and it passed with flying colors. So that is going to hopefully be fully packaged and ready to ship out probably January or February next year. So we created our own scar gel, with obviously some good thought behind it. So we're gonna list out all the ingredients. We'll have a website that tells you guys like what went into the design of the scar gel. It's not just like, we don't just like make random stuff, right? It's all the same degree and level of thought that we put into our videos. Goes into any of these products that we're now working on. We also have a shampoo and conditioner that were just formulated based on, again, that hair transplant, or that hair restoration video that we put out, on like natural products and things that can help as adjuncts, not replacement for the true medical therapies, but as adjuncts too. So that is formulated, and again, we have to run all the testing on it, and all that kind of stuff. So all these products, they take a long time to go from conception to actually be in your hands. So yeah, and we're doing some other stuff related to other hair products. So that's in the works. One of the biggest pieces of news I would say is that I decided to focus and I might make a video on this one day, 'cause I think it's interesting, sort of my thought process behind it. I won't go into like too much detail here, but just to tell you that I've decided to focus my surgical practice just on hair transplant surgery, and lip surgery. So as you guys know, that has always sort of been the dominant procedures in my practice, though, I've done a lot of rhinoplasty and facelift surgery as well. And I, for now, continue to at the hospital, teaching residents, doing all that with complex nose surgeries. But I decided to really just focus in on the procedures that we were just getting, luckily, lots of people from all over the world who want to come to the practice. They care about quality, they care about results, and we're grateful for that. So we had enough volume to say, look, I'm not going to dabble in all these different types of procedures on the face and the hair and all the things in between that I was offering, uh, and really just focus in on things that I could be doing all week long, kind of throughout the week, able to juggle between some of the hair stuff and the lip stuff. I really wasn't able to juggle all of it anymore, and be like the go-to guy for these things. So I feel like sticking to mainly cosmetic lip surgery and the full range of hair restoration, not just surgery, but the medical side of it too. And then even remember on the surgical side, I mean, we offer, surgical hairline advancement, male and female, transgender, all types of hair transplants, eyebrows, beards. I mean, we really do the full breadth of hair. So even that is sort of exhausting in and of itself. But then I've developed this expertise for lip surgery that I can't just give up. So whatever, that's happening. So yeah. So unfortunately, a lot of people who were scheduled for consultations for some of the other procedures, we had to kind of give them their consult feedback and cancel them, because by the time I'd get to them for consultation and be able to do their surgery, it would have been like the end of 2023. So I just had to make that happen. And I don't know if it's going to be the absolute like end of those surgeries for me for the future, but at least for now, that's the decision, and we'll see if that changes. And it is kind of weird because obviously it's not like I've forgotten how to do those other surgeries or that I didn't wasn't good at them. I mean, we had some great results, so it's like it's weird disconnecting from them for the time being. But we'll see what the future holds. But I know some of you guys have commented that, like, Linkov's good for hair, but he's not doing hair all the time. So I don't know. So now I pretty much am. So just keep that in mind. Cool. So other things, we have a lot, there's a lot, so I want to just kind of update you guys, and then we'll go through some Q&As, of course, as well. Next thing is we are planning like a competition of sorts, like almost like a Mr. Beast style, but not as crazy, a little more contained, for offering essentially free hair transplants. I know it's a big deal. So that people don't necessarily have to feel, because our prices have gone up, so not everyone can afford it. And people feel like, oh, and I got to go to Turkey, or I got to go someplace where it's like $2 a graft. because they can't afford anything else. So we at least want to give people the opportunity through like a fun, professional kind of competition style thing where it'll be a fun video to make for everybody, but also kind of going more in depth into people's stories, why they want to transplant, and then of course, kind of taking it through the whole transplant journey. So we feel like it's a nice way to give back, and it's a nice way for people who otherwise wouldn't be able to see us to still come through and to get proper treatment with us. So that is coming. We're planning things out. We're going to have an application that will be going out soon for how to sign up for that. And we'll see. I don't know when like the first actual competition will be or when the actual surgery will take place. We'll try to do the competition hopefully this year, by the end of this year, and then the actual surgery would be sometime in like maybe the first quarter of next year. I want to start doing longer form videos, like podcast style things with like good scientists. Scientists mainly in the hair space, but also maybe some other medical people, and really sitting down having a long conversation. I think that would be fun, and that's something that we haven't really done much of. I actually did it in the early days when when our like channel was just kind of getting going, and we did it through Instagram. We did like Instagram types of videos, long form kind of style of podcasts, and then we put them on YouTube. But that was a long time ago. But yeah, we want to expand on that. And then, of course, we want to, continue to make these great educational videos for you guys as well, keeping it fun, but also teaching you and, without the BS. And and then I'm also working on a new space. I bought a new medical space for my practice, and it's going through like approvals to even start we're doing like a gut renovation on our own space right now. As some of you guys know, I rent rooms in a medical space in Manhattan, so we have our own in Manhattan that we are building, actually with the help of an interior designer that we found through YouTube. So it's kind of funny. But then, of course, there's lots of other people involved with the construction and all that. So that pretty much sums up what we've been working on. So if you guys haven't heard from us with the Q&As, and we're trying to keep up with the 2 videos a week, so there's a lot happening. So let me go back here and see what the questions are. Okay, so there's like facelift, and I'll still continue to make videos about like some facelift stuff, rhinoplasty stuff. I mean, it's not like, I'm not going to be involved with that. It's just on the actual surgical side. I can't do it all. There's no way I can be the hair guy, the lip lift guy, and then all these other things, right? I mean, there's some guys who just only do rhinoplasty or only do facelift surgery, and I guess I've decided like if I can't be the best at it because if I'm not doing it all the time, then probably best to leave it for someone else. Uh, okay, so 33-year-old male who wants a lower facelift for his nasolabial folds. Am I too young? Should I wait? So there's been a trend towards doing more and more facelift surgery specifically on younger patients. So I've heard in my practice as young as like 19, meaning I didn't operate on the 19-year-old, but there was a patient who came to me for a lip lift consult who was like, yeah, in South Korea, I did a facelift when I was 19. And I was like, holy moly, I didn't know it was being done that young. I mean, I've never heard of that in the States. But yeah, I've definitely heard of some colleagues doing facelifts on patients in their early 30s. I don't know. In my opinion, it's kind of a big surgery, especially for someone that young. It has real risks, and like any surgery, but nerve damage risk, big areas for scars if things don't heal perfectly, could be a problem, at a young age. So I I recommend that people explore some other options before jumping into a facelift, especially in their 30s, especially early 30s. So things like filler, thread lifting, radio frequency devices, Sculptra, all of those are good options that are non-surgical that might help. I think people should wait longer before they do a full-on facelift. Okay, so do you ever use nape hair as a donor area? Um, Not too low. First of all, the scarring would be very visible. And then also, the hairs are very, very fine, so it's not like typically the best place to harvest. But we do go low on some patients, and also you have to remember retrograde alopecia, where the alopecia, like with if the crown is thinning, it's going to start to create a smaller donor area. But the other thing that could happen is that you can get thinning that comes up from the bottom up, from your nape up, and that can sometimes be a problem. Uh, Liz, my wife, is in in the room next door, and she's listening to the podcast, but the reverberation of sound is messing with my ears, so I'm gonna ask her
Okay,
to
sorry, sorry.
turn it off.
But make sure you answer Dandy's question. So you
Okay,
might want to
yeah.
scroll down.
Yeah, I'll get to people's questions, don't worry.
Yeah.
Okay, Liz. Okay,
Okay.
thank you.
Just try to.
Okay. All right. Who? Let's see. Am I the only one who doesn't ever want hair transplants or plastic surgery, but still avidly loves Dr. Gary's videos? Oh, thanks, Amanda. Appreciate that. Yeah, I mean, I see this as this meaning our channel, as not just like telling, and that's why people, I think, like us, is that we're not trying to tell people like, oh, go get surgery. A lot of times I'm making videos against certain procedures and just telling people how it is, and then they can decide. And if I've talk people out of certain surgeries. Sometimes I feel like that's as good of a thing as telling them about something and then they get excited to do that surgery. So yeah, I mean it's definitely very much an educational channel. And some people just have no exposure or interest in like getting the procedures, but they just have no exposure to any of this, right? Like they went to school for. Let's close the door, please. Thank you. They went to school, say, for something totally different, right? And so they never have seen any of these surgeries in real life or never even heard of them. So it becomes a nice possible way to learn about it. All right. So let's see. Told you our podcast. Oh, Brains and Gains podcast. Thanks, man. Yeah, I appreciate that. He had me on early on and knew that we were, going to do well. So all right, let's see. So, besides hair transplants, what type of surgery do you perform the most? So, other than like hair stuff, so that's hair transplant, surgical hairline advancements. Other than that, at least, especially now as I've refocused the practice, it would be cosmetic lip surgeries. And the most popular one there is a lip lift, though we do corner lip lifts. We do like lip advancement surgeries, lip reduction surgery. So there's like all types of like variants of lip surgery. And let's see, why does the upper lip change after a rhinoplasty? It's a really good question. It's very common after a rhinoplasty that the philtrum gets longer. And many of my lip lift patients, they come to me after having had rhinoplasty, and they're like, like seemed okay, but then my and they always say it's because my tip got lifted and now you can see more exposed philtrum. So now I want it reduced. But most of the time it's not so much that the tip was rotated up, it's really that you have a disruption of the orbicularis oris muscle. It's the muscle that wraps around the mouth, and so on the deep end some of the attachments attach to the base of the nose, and as you're doing a rhinoplasty, especially a rhinoplasty that involves any kind of tip manipulation, you're going to disrupt some of those muscle fibers, so there's like almost a loosening or a relaxation, and so this area starts to get longer. So some people come, and that's actually also why in an ideal, and we have a video on lip lift and rhinoplasty and which one to do first. In an ideal world, you'd get the rhinoplasty done and be happy with it and have it set, and then you do a lip lift, right? Because if you do a lip lift first, then a rhinoplasty, and now the philtrum's longer, and now you're doing another lip lift. Sometimes I combine those surgeries if people want a single recovery, but yeah, those are just some thoughts on that. Um, is there a cure or treatment for scarring alopecia or like CCCA, which is cicatricial alopecia? I wouldn't say there's a cure. Sometimes it's hard to figure out what the underlying reason is, but there's inflammation. You have to be very careful about transplanting someone with a scarring alopecia. It can be done, but it needs to be in the late stage, like the burned out stage of the scarring. So you always do a biopsy and then you send it to a trusted. I sent it to a dermatopathologist, Dr. Mudgill, who's like really, really good, and he's in New York City. And so you send it to someone like that, and they'll tell you under the microscope if it looks like there's a lot of inflammation. If there's a lot of inflammation, then usually people are on different steroid treatments. I usually send out to dermatology to manage the steroid treatments. And then over time, as things get better for them, for the patient, then you can sometimes go down the road of a hair transplant. But you just have to be careful. You don't want to transplant at a very active phase of scarring alopecia because the hair is going to get destroyed and nothing will stick. All right. So, do you do otoplasty from Kevin? Well, not anymore. I did as of a month ago, but I had to focus, man. Had to focus. What are your thoughts on supposed hair stimulating shampoos? Yeah, I mean, we're coming out with our own. It's again, it's not none of these shampoos are meant to replace like minoxidil finasteride. They're also not as studied as like laser light therapy, PRP, microneedling. Those are going to be like your main ones. But then the shampoos, I think, are a decent adjunct to the other stuff. Could you do a video on Taylor Swift? Lots of people think she hasn't had work done, but I think she has. I'd love to hear. Yeah, I mean, I think that's Marco. Add that to the top of our list. I think that's a good one, a good person to analyze. She's been in the news a lot lately, and she's always in the news. I feel like she's always a very relevant. So yeah, we'll dive deep into that analysis sometime soon. Is it possible to get breasts lifted without implants? I think so, but that's not my area of expertise, so I try not to comment too much when it comes to that. But we'll try to get like maybe a body plastics person on the channel. Like that's the thing. I want to do those longer kind of podcast style videos, and then we can interview some really cool people and folks who do things that I don't do. So that would be great. And let's see. Do you recommend people to get on finasteride after a procedure? I didn't want to, but I've heard a few doctors recommend it. Yeah, when you get a hair transplant, for many male patients, finasteride just makes sense. I mean, side effects, aside, right? Obviously, there's side effects and there's risks of that. But and in our video on finasteride, we go deep into those side effects. We don't shy away from them, and so my patients know that those are real and they can happen. But you have to consider, like, what could happen if you're not on it, and if you have a lot of pre-existing hair and now you've done a transplant, especially if it's a transplant to do some, refinement at the hairline. Imagine then you lose the rest of your hair. It's not gonna look great, right? As an extreme example. For some of my older patients where the hair the pattern has been super stable for years, many, many, many years, it's usually less relevant to bring up medical therapy. And also for the patients, even my younger patients who are like Norwood 6 and 7. I mean, the medical therapy is not going to do a whole lot for them. So then you have to consider the risks versus the benefit, right? So for those patients, sometimes transplant alone is fine. But again, like the expectations have to then go down. You're not going to recreate what they originally had. So I think if people, it's like, say it's like a person in their late 20s and they're, losing hair, and it's not super rapid. If they're rapidly losing hair, you definitely don't want to do a transplant, but they're noticing year after year there's some loss. That as a patient, and then like let's say they still have a really nice solid like frontal forelock, maybe they're like a Norwood 3, right, where it's like deep recessed corners. That's a patient where, we would do a procedure of say anywhere from like 1600 to say 2200 grafts. But like the graft that's not doing anything for their nice forelock and all the mid scalp and crown hair that they currently have. So the only way to preserve that is, and to feel good about like your odds of preservation other than just leaving it to chance, is to be on medical therapy, and namely for preventing further loss like finasteride, right? So if they're not on it, the problem is they're investing into a hair transplant, wanting results that are going to look good for years, on end. And you have to worry about that, not just how the results are going to look in 2 years, but how are they going to look in 10 years, 15 years. So, your best odds of having your hair look as good as it can in the long run is to be on the medication and get your transplant. So most of the time it's not or. But again, each situation is a little different. Let's see. When you prescribe oral minoxidil, what dose do you start men at? 2.5 milligrams daily is the answer. Best time to take it, it doesn't really matter. Should it be taken twice a day? No, it's a once a day medication. Is it possible for patients to use nape hair? Okay, I already answered that. Okay. So Dandy asks, "Hi doc, I'll be flying to Turkey in 2 weeks for a hair transplant. When would it be safe for me to sleep on my side again after surgery?" So, usually, in terms of sleeping restrictions, I put that on patients for about 3 days. So after the third day, you can more or less go back to side sleeping. First 72 hours, you're at the highest risk of disrupting your grafts and that rubbing them off. After that, they're fairly anchored in. It's kind of hard to mess with them too much after about 72 hours. So yeah, so about 3 days of restrictions. So like elevated sleep ideal is like a recliner with a neck pillow, where your grafted areas aren't touching anything, so that's good. And Madonna did not tweet me. That was a joke from Marco, to get you guys here, I guess. Let's see. If a lip lift is done, can the corners on the lower lip be targeted? Well, the lip lift is meant for the upper lip. When we talk about corners, usually we're talking about the upper lips corners. And my approach in the practice is to wait 3 months minimum between the upper lip lift and the corners. I don't like to combine the corners. Most people don't end up needing it. And for the ones that can benefit from it, we always make sure that the healing under the nose goes well because the corner lip lift scars are in much more visible locations. So that's why I don't like to combine it all together. Some people do. Also, like as the lip changes shape from the upper lip lift, it's nice to see how that shape settles out. And then, then kind of see how much of the corners you need to remove. Usually, it's not as much as maybe you initially thought. So that is my preference, the staged approach, rather than just doing it all at once. So I that's how I do it. I mean, not everyone does it that way. All right, so let's see. So someone added, what is this? Hey doc, from Lauren. What's the best procedure for a small waist? I'm not overweight, just want a smaller waist. And what are your thoughts on abdominal etching? I really try to avoid talking about things in detail when I'm not an expert in it. So my background is the head and neck, and so anything you have about the face, the neck, the hair, that I'm your guy for. But I'm not sure how to answer your question because that's not my expertise. Abdominal etching, I know some guys who do that, like some of my friends, and I don't know. I mean, I think it's an option, but I couldn't tell you pros and cons of all of that. All right, so let's see. I hate my ears, but only because I've lost half my hair that doesn't cover my ears. I also have skin cancer in both my ears and could someday lose my hearing. Oh, geez. Sorry to hear that, Shireen. I wish you all the best. Definitely, the skin cancer always comes first. Make sure that's fully addressed before any of other like cosmetic stuff. All right, let's see. So got a lot of people here. Daryl, hello. Microneedling. Let's see. Um, from Licata. Hi, Dr. Gary. Someone that got an FUE said that they had a panic attack due to the adrenaline in the anesthesia. Okay. So yeah, so anytime you have like lidocaine injected for numbing, it almost always has epinephrine in it. You can get plain lidocaine. We sometimes combine that into our mix, but because if we're trying to do like say a tumescent mix and we have concentrated epinephrine, then the lidocaine is not going to have epinephrine because we don't want to go too much on the epi. The epinephrine is essentially adrenaline. It's going to make the heart beat faster. That will usually resolve within like 5 minutes or so, but that can make people very anxious. And some people will say that it's like an allergic response. Like some patients will say, like, "Oh, I can't get lidocaine with epi because I'm allergic to it." And I'm like, "What's your allergy?" And they're like, "Oh, like I get my heart racing." And then so that's not an allergy. That's a normal physiologic response to the adrenaline. But that always gets better. So. Uh, Listen, I mean, some people panic, but usually if you talk them through and explain what's going on and why it's happening, then they're able to handle it. Okay. Does over-the-counter Rogaine work for not just men but women, especially older women? Yeah, Maria. I mean, it there is first of all Rogaine for women with a lower concentration. So yeah, I mean, it has definitely been shown to help in men and women. In women, you can get hirsutism, which is increased hair on the face. That is something to watch out for. And many times these days in my practice, we're switching people over from the topical Rogaine or minoxidil, which is the generic, to an oral form. We find that it's a little bit more dependable and easier to stay compliant with because it's just a once a day type of medication as opposed to twice a day of putting the topical stuff on. Have you ever been sued, copyrighted for speculating about a celebrity's alleged plastic surgery? Answer to that, Amanda, is no. These are public figures, and unless you're totally like slandering them or spreading all types of false stuff that you think to be truth, I don't think we're doing anything wrong. Our stuff is pure speculation, and we use it as a vehicle to teach, and we find that people enjoy hearing about it, whether it's a form of gossip or not. You can debate that to folks, but I think that most people watch our stuff because they're looking to learn, and they enjoy to see like maybe their favorite or sometimes least favorite celebrity as just like the substrate, and then we talk about all the different procedures and try to elaborate on them, and it seems a little bit more relevant to people than when we just talk about the procedures. We have still pure educational videos, but as a general rule, they don't do as well as the celebrity videos. So we try to mix and match a little bit. I feel like I have to sneeze. Excuse me. Sorry, guys. I'm not sick. No COVID. Just I don't know, maybe dust. Let's see. So let's see who else. Who else? Any other questions? Plenty of questions. Okay, okay. I have a question. I got my FUE hair transplant and I'm at the 7 month mark, and only the hairline has grown in and nothing else has been growing. I'm worried it might be a failure. So, yeah, people get excited around 6 months, 7 months because they're like, oh my God, so much time has passed. Like, where are the hairs? Is it growing? Is it going to grow back? So I tell people just be patient. Wait at least a year before being like, okay, this definitely didn't work, or getting upset about it. Remember that density is rarely, let's say, going to be like your original density. So just kind of know that when it comes to hair transplants. But of course, if they transplanted an area that completely showed, no growth, like that's not good. By 7 months, you should usually be seeing at least something in an area, but it's not going to be the full result. So just be patient with it. And I also remind people that you trusted the clinic that you went to, right, initially when you had your surgery. So trust them enough to go back and be reevaluated and talk to them. Make hopefully they've captured pictures from before your surgery. You can review them, and there should be noticeable change from before to after. Now, sometimes again, the density isn't maybe exactly what you had in mind, but that doesn't always mean that, or it rarely means that it was a failure of the surgery. But of course, if there's like nothing there, or if things are growing in really, really odd directions, like that's not great. But trust the original clinic, ideally, right? Because you picked them. Why would you have picked them if you didn't trust them in the first place? So trust them to go back, be evaluated. Hopefully, they can be honest and truthful, and just frank with you, right? I mean, when people come back for our visits, we look at the original pictures, we look at how they look now and their new pictures, and we just have a nice open conversation, and people usually are very reasonable, and we're reasonable back as far as like next steps if they wish for more density, or if there's a new area that was not addressed that they now want to address. All right, so let's see. Someone else asked question. What's the best option for under eye hollows for a young 30-year-old? And any tips for thin eyebrows? Well, thin eyebrows, there's microblading, there is tattooing, and then there's what we do in the practice, which is eyebrow hair transplant. So hair comes from the back. We recently posted on our Instagram at least one case, and if you go to our gallery on the website, you'll see some more examples. But this was a lady, this one here, who had an eyebrow hair transplant, thin eyebrows, and I actually then did a little tiny touch up on her, which is something that we mentioned in the description on the website. But those are the options for eyebrows, and then for under eye hollows. Well, your options are going to be depending on the type of hollowing. Sometimes filler, some people use threads, but I haven't found that to be overly helpful. Some people put PRP in there, but that's going to be short lived. Sometimes fat injections can help, actually. So, like a fat transfer. Sometimes lower blepharoplasty surgery to reposition the lower eyelid fat pads over to the cheek area, and that can help sometimes. So, those are sort of your different options. Someone's saying, do you have any opinions on cosmetic surgery to reduce bulging eyeballs common with graves? You have to seek out the help of an ocular plastic surgeon. They definitely have ways of reducing that bulge, and usually it has to do with carving out some of the bone to allow more room for the eye to settle back on. I definitely was involved with some of those surgeries in my training, though that's not my specialty. So, yeah, ocular plastics would be the place to go to for that. Let's see. And oh yeah, some of you guys, not that this came up here, or maybe someone did, but some comments on the videos recently have been like about my hair regrowth. So I'm getting, gotten some eyelashes back, some brows, mustache, even like some hair down here that now I have to shave, which is annoying, but it's what it is. So some of that has returned, and people are like, "Well, have you done anything?" Honestly, no. Maybe reducing stress a little bit, but we have a lot going on, so things are always like baseline stressful. Still nothing on the scalp, but honestly, like I've kind of psychologically moved on, so I'm cool with whatever. But it is kind of nice to get like the brows back. They're not like how they used to be. They're a little weird, but they're what they are. So yeah, so I haven't been doing anything like special as far as treatment. And yeah, I don't know. I even stopped like my allergy shots. I haven't gotten them in a while. I tried to change clinics, and then it took them forever to get the shots to the new place. So I just haven't gotten them in a few months. All right, so let me try to keep going down. All right. A documentary series on hair transplants. Whoa. Yeah, that is our goal. And also I thought it'd be fun one day to be like Anthony Bourdain style on the videos, like going to like say South Korea or going to Turkey. Imagine, I'll show up in Turkey and and just do a documentary about like how things are being done there, but actually seeing the clinics and being there and reporting back to you guys. I think that would be super fun. In all honesty, I don't love traveling. Like I'm kind of a homebody and love to be with my family. So I don't know. We'll see, but we'll definitely have to plan some of these trips, just because I think there are some good stories to tell. And honestly, it'd be super interesting to meet with different colleagues from around the world, share stories, share expertise, and also try to document that as we go. So that would be a lot of fun. Maybe one day we'll start doing more of that. Let's see what else. Will brow transplant make the brows grow really long? Yeah, when you do the eyebrow hair transplant, you take the hair from the back of the head, move it to the eyebrows. You have to trim them. Like it depends on how quickly hair's growing, but usually at least every 2 weeks they've got to be trimmed. But they still look good. But yeah, if you just let it go, you look kind of funny. Perfect for Halloween. But no, I mean, in all seriousness, people trim it and they're happy, and it gives you that natural three-dimensional fullness to the brows, which is nice. Are plastic surgeons trained in wound healing mechanisms related to skin cancer while grafting fat from one region of the body to the face? Yeah, I mean, of course, we're trained in wound healing mechanisms. And then, but again, skin cancer has got to be addressed first. There are some plastic surgeons that will remove the skin cancer and then be able to do the grafting or the reconstruction. But usually, the people who remove the skin cancer is like a separate type of like a oncology type of surgeon. Um, or sometimes a dermatologist with Mohs experience trained in skin cancer. So yeah, let's see. Uh, my hair is thick, but I think it may be thinning in one spot, like I noticed this week. All right, that's common. Um, okay. Any good alternatives to buccal fat removal? Yeah, I mean, not really, not really. So sometimes losing weight will reduce the overall fullness of one's face. So that might be an alternative, but one that obviously, a lot of people don't want to hear about or maybe find it very difficult to do. But some people's just facial habitus is such that it's a bit more full. And I really have very rarely seen a buccal fat removal result that was like, wow, this is amazing, and one that has been sustained over time in a nice, pleasing way. So, you guys know my thoughts on that. We have a whole video on buccal fat removal, but I wish there was an alternative. There kind of isn't a great one. Thoughts on preventative Botox? Yeah, sure. I mean, Botox can be used to prevent wrinkles from really setting in, like the deep etched lines in certain areas can be to a degree prevented with preventative Botox. But you don't want to start so early that you're just freezing muscle from age like 18. But usually patients in their late 20s, early 30s become candidates for preventative Botox, and you want to stick with lower doses. You don't want to just like go crazy with it, because the muscle, first of all, some resistance can form to the medication or to the toxin. And secondly, if you inject the muscle at such high doses repeatedly from a young age, I mean, you can atrophy the muscle, right? So then, especially if you're doing it in the frontalis muscle is the only brow elevator. So if you do that into the frontalis from a young age, you can atrophy the muscle, and then you get these like saggy brows. So not great. So you just have to be very careful with how it's being done. My hairline is receding on only one side. How long should I wait to get a hair transplant? Full head of hair, otherwise I'm 23 male. Yeah, so usually it's the right side that recedes more than the left. That's very common actually, and no one knows why, but it's just like in 90% of cases, there's this asymmetrical recession where it's more right-sided. And in terms of how long to wait, well, my thing is like it's not just about age, but it's about stability. So let's say you're fully stable and especially controlled on medical therapy, finasteride, maybe you're even on some minoxidil, and things have been nice and stable. First of all, don't rush into it because you're 23. But if you are nice and stable for say a year and nothing's changing and you're just really bothered by this recession on one side, go ahead and address it. But I wouldn't just do this. Like if you came to me at 23, you have a little recession on one side, you're not on any medical therapy, I wouldn't do the surgery, wouldn't offer it. I'd say exactly what I just said, stabilize on medical therapy first, and then we can reevaluate it. There's no reason to rush it. And you don't want to have us do a transplant, then you have this nice thick hair here, and then you do nothing else, and then like 3, 4, 5 years later you have like most of this gone and you have a little bit of hair from where we transplanted. It's not a great approach. I'm 30 and I have a grandpa ring. Can I make it fall out quicker? A grandpa ring. Okay. I mean, I haven't heard of it referred to as that exactly before. That's interesting. I like that way of putting it. Like I've heard, moon shape, and there's the horseshoe. Grandpa ring. Okay. Can I make it fall out quicker? I don't think hair transplant is for me. So you want whatever hair you have left to fall out quicker. So, first of all, you can shave your head. That would be the obvious answer. And if you don't want to be shaving your head and you just want to get rid of all your hair, you could do laser hair removal, potentially. But yeah, I mean, though, I can't think of anything else. Either shave it, and there's no medication that will make your hair in those areas that's DHT resistant fall out any faster. A lot of okay. Let me go to like the most recent ones and see because I'm like so behind here. Um, Kudos to Mrs. Doc for landing this catch. She's a better catch than I am. She's great. What is going to be the next fad in face and neck? We went through the over pumped face to remove wrinkles in the face and big plumped overdone lips. Oh, that's an interesting question, Smurfette CS. Next fad. So well, I'll tell you about a video that I really want to make. It's about that Elicor, like the micro coring type of device that people are using, where they're removing. It's kind of funny because I do like a lot of hair transplants, and we do FUE, so we take out the little tiny uh, punches, usually about like 0.95 millimeters. And the Elicor, my understanding, it's this like little machine that punches out small little circles of skin, but I think it's more on the order of like maybe 0.5 millimeters. But this is what I have to review for the video. And by doing so, the idea is that it actually has very little scarring, or like difficult to perceive scarring, but it causes like a tightening, right? Because you remove some skin and it causes it to kind of scar down, but without a visible scar, and tighten. So it's being used as like a tightening type of device, as like a generation beyond, I guess, the radio frequency energies devices. But I don't know. So that's one trend that I just want to look closer at and see what results it's generating, and if it's at all, potentially beneficial, and if it's truly no scar, or if people are getting some scars. My guess is probably some are getting some scars, but we'll see. I'll need to do that deep dive to bring you guys that video. As far as just like next trends, who knows? I think a lot of this stuff. That's what's interesting about doing the celebrity videos, because these celebrities are oftentimes setting the trends, especially it seems like the Kardashians are kind of like whatever they're doing, a lot of people want to follow it. And I don't agree with that, but that's kind of how the world works, whether it's a Kardashian or some other celebrity. And so I think by doing the videos, we're going to stay up on the latest sort of trends, because in a way they're trendsetters, as far as if people want something bigger or smaller, or what they want next. But at the end of it all, I think, well, one thing is, I don't think people should just jump on the latest trend. That's one, I think, important message, because again, the surgeries are going to be permanent results, right? So you don't want to do something that's in today, gone tomorrow. Uh, and the other thing is that the newest technology isn't always the best or the safest. A lot of times, these companies, coming out with the latest laser or the latest whatever tightening device, they need to sell the equipment, because that's their business, and that's they put all this R&D into it. They have all these salespeople and all these whatever that they have to support, and they need to sell the machines. So they're going out there pushing it. It's in the news. They convince some doctors to push it, and now it's like the latest greatest thing. But from a patient's perspective, God knows, how it's really going to pan out. If a year later it's going to be off the market, if they're going to have lawsuits because people got hurt by the technology, I don't know. So I'm like weary, because I like new tech and I like new things, but I'm always kind of trying to put the patient first. And I can't help but think that, like, a family member or a good friend of mine might be getting something like this, or myself, and like, is it the best approach? And that's how, I don't know, that's how I work with all my patients. And so if I don't feel confident about like a technology, especially one that has real risks, like, I'm not going to push it, and I'll recommend that people wait and see, if it remember how hot, like, well, that's kind of an oxymoron, but cool sculpting was very much in, right, for many years. All therapy before then, all therapy more for like tightening and making everything great with the face, but then people started to feel like, the fat was being melted away with the machine, and it's just like kind of fallen out of favor in most places. That was like the old therapy, and then cool sculpting that was supposed to melt away your fat. And as we know, there's different paradoxical reactions where people actually get more fat in the places where they're supposed to get less fat, and getting kind of like different types of burns from it, like like kind of frostbite or whatever. It's just so nowadays, like, people aren't really doing cool sculpting, right? Very much. But that was like the hottest thing, where they were selling all these machines and offering it in every clinic, and it's just fallen out of favor. So I just don't think that people ought to jump on the latest trend. Is where I'm going with that. Okay, who's next? Okay, let's see. Um, what else? Okay, I'm trying to answer someone else's question. We have some people who have asked a lot of questions, which is great. But I'm trying to get someone new in here. Um, right. So let's take one from Oliver. Can psoriasis cause hair loss or not? It can, to a degree, contribute. You definitely want to have the psoriasis under control, because that degree of inflammation could sometimes increase, hair loss. So there is some relationship there. What else? So I'm almost 40 and have Harrison Ford level hair thinning. Also drink quite a bit. What's your solution to thicken this without sobering up? Well, healthy habits are always a good start. Um, and we always talk about the medical therapies, right? The first line is going to be finasteride and minoxidil. That's going to be your first line. Then you've got the microneedling, laser light, and PRP as like a second line. And then you have some nutraceuticals, biotin type based vitamins, which are just okay. And then, of course, the shampoos and stuff like that, that can sometimes be just an adjunct too. So I would consider those medical therapies, and no transplant until you're nice and stable as far as your what medical therapies you're on, and just the overall foundation of your hair. Uh, okay, yeah. Can I ask about your thoughts on Nutrafol? Nutrafol, it has some data to support it. I just actually just mentioned it in the sentence prior, as far as a nutraceutical that can sometimes help. But again, it's not a replacement for those top five medical therapies that we're always talking about, and that we have videos on for each of them. Can Sculptra be used to replenish buccal fat loss? It's a good question. Sculptra is meant to be injected more superficially, so you're not going to put Sculptra at the depth of the buccal fat. So while like if you just put it superficially in the area where the buccal fat pads used to be, maybe you'll get some level of gain. But again, it's not like replacing it, because it's not in the same compartment. The Sculptra is going to be much more superficial, meaning closer to the surface. But yeah, Sculptra. We have actually the other update I didn't mention earlier was that we have a great nurse injector in the practice now, Nikki, and so she has a lot of experience with Sculptra and all the other injectables, and she offers that now in the practice. So if you guys wanted to reach out for something other than hair and lip surgery, Nikki is doing the full range of injectables currently in the practice. So that's nice. Let's see. Any experiences with minoxidil? Is it any good? Yeah, we have a whole video on minoxidil, both in its topical and its oral formulations, and overall, we prescribe it quite often. Is it unwise to have multiple procedures done at the same surgery, like an extensive facelift, a rhinoplasty, and a lip lift? Therese, that's a good question. So depends on a lot of things. For I would say 99.99% of surgeons around the world, doing an extensive facelift, rhinoplasty, and a lip lift well is not really in their repertoire. I can maybe think of very, very few people. I'm not going to say anyone's names, but there's very, very few people out there who can actually get that done in an acceptable period of time and do each of them well. So usually, I can tell you when I was doing all of those, I would sometimes combine facelift with a lip lift, but and sometimes a rhinoplasty with a lip lift, but never um, all three together. It just takes a long time. So these surgeries are not like quick 1, 2, 3. I mean, they're involved procedures, and so you don't want to be under anesthesia for, especially because a rhinoplasty, you're going to need essentially to be intubated for. And so that's a long time to have a machine breathe for you for elective cosmetic surgery. The usual recommendation in most surgical facilities, based on kind of the different governing bodies that accredit operating rooms, is about 6 hours. So not to exceed about 6 hours for being under anesthesia, for cosmetic elective, well, for elective surgery, but obviously cosmetic included. So, facelift, rhinoplasty, and lip lift, for to do that well, like I said, I mean, I can think of maybe one or two people who have the experience and the speed of surgery, to be able to maybe do that within somewhere on the order of 8, 9 hours. But I can tell you that I'm not like the world's fastest surgeon. I don't like to work super fast. It's just not my style. So there's no way I could do that even in 8 hours. I mean, that's a lot. It's a lot of surgery to do. And so and then plenty of people are going to offer it, but that doesn't mean that they're going to do it well, right? So a couple of things there to consider, but excellent question. All right, couple of questions here. Is scalp acne a thing? Yeah, I mean, I don't treat that. I'll only be on the lookout for it. If it's like someone coming to me for a transplant, but if it's anything like acne related, I will send to a dermatologist to properly address. Cool. Thanks, Shireen, for that. And would you recommend hairline advancement on a naturally high hairline that isn't receding? So, good question. So, like, basically, like, who's a good candidate for a surgical hairline advancement? You have to be careful with the hairline advancement because you do get a scar, and if your hair recedes back after you've gotten that scar, there's nothing that will hide it. So, um, in my practice, the way I treat it is for women, any age, well, 18 plus, for the surgery, as long as their hairline hasn't been receding. So exactly what you're asking. If it has been receding, I'll avoid it, and we'll try to figure out why it's receding, because in women, it's not really supposed to happen. And if it is, there's something a little bit more unusual, a little more rare. There's frontal fibrosing alopecia. There's other conditions that could do it, though, with all those conditions, you don't want to be leaving someone with a scar on their head, so in the front of the head. So that's for women, and then for men, I will not entertain an SHA, which is a surgical hairline advancement, on any guy under 35, as like a general rule. I mean, if you're 34, or right around there, then we'll talk about it. And then if they're that age, they also have to demonstrate no recession at all, in their life, and at least be open to medical therapy if they were to start to see some signs. And that's a rare category of people. There aren't that many people who fit that category. Most guys by 35 have had some signs of recession, which in my book means that they're not a good candidate for SHA. So I pick very carefully. I really cherry pick my male SHA patients. But for women, I think it's generally an overall safer, like, approach. Not safer as far as like surgical risks, but safer as far as kind of long-term cosmetic outcome. Uh, but also, in general, just about SHA, especially for women, I think it's a really nice surgery. What I tell my patients when they, do the consult with me is that, like, try to be okay with about like 2 centimeters of lowering. If you want 4 centimeters or plus, I can send you to people who will do that for you. But what I've learned from in my practice and with the people who I train, when you start to really push it beyond about 2 centimeters, regardless of how your laxity sort of feels, because right, you can check the laxity like by moving your scalp, but Even people who have really lax skin, once you start pulling it, after about 2 centimeters, you start to feel some degree of tension, even if you've released the scalp all the way, back. And that tension is going to backfire because it's going to create a wider scar. And when the scar is wider and thicker, even if you try to follow it up with like a hair transplant into the scar down the road, it's never going to heal as well as if you have a thinner scar. So I think it's a great approach because you get that nice density of your hairline. For those patients who have a high hairline and they want it lowered, SHA really is a nice option for the female patients. But they just have to accept, of course, the scarring, and they have to accept that it's not going to come down maybe as low as what they want it to be. For many people, 2 centimeters is plenty. But for some, the hairline is like up here. And so, they definitely will aesthetically need more than 2 centimeters. But what I tell them is, look, I can partly get you there with the SHA, and then just expect that you'll want a hair transplant down the road. But that's very different than taking like a 4 centimeter stretch and only doing a hair transplant, because your density is not going to be, especially with a singular procedure, it's not going to be as great as the natural hairline that's brought down. So just some caveats on SHA, but important points. I'm going to answer these three questions up here, and then we'll call it because it's getting late. Hey doc, been enjoying the content. Thank you. Question: a woman who has PCOS and diffuse hair thinning who worries about finasteride regarding pregnancy. What other drugs on top of minoxidil can help? So spironolactone is something to look into. It has some anti-androgenic properties, and it's had pretty good track record in the data. And so you have to be careful about low potassium levels. So you got to track the potassium levels. So I usually don't prescribe the spironolactone, but recommend that people talk to their primary care, or usually it's a primary care doctor that would prescribe it. But it's common for like women with acne, they get spironolactone, but like separately for hair loss, it's actually a beneficial thing. And then, of course, also don't forget about laser light therapy. Those caps or the hats or the combs. I mean, those have some data to support them, of course. PRP treatments can also be helpful, and microneedling. So look into that as well. That's for Ray Guyen. Then we've got Brooklyn here. So I'm 29. Over the past year, I've been getting Sculptra to help replenish the volume loss I accrued after struggling with an eating disorder. I've been happy with the results. I just miss my chubby cheeks. Yeah. So thanks for sharing. Yeah, Sculptra can really be beneficial, and it's one of those things where it's not like you get the Sculptra and all of a sudden, I mean, you're gonna have some like a bloated type of look because of the like the saline component of it. But as far as like the improvement, it takes time, and it takes many, many months to start to see change. So you have to sort of trust the process and trust your injector. And a lot of patients get frustrated with that approach, but that's how Sculptra is. It stimulates your body to produce collagen, and so that is sometimes a good option. Got a couple of these questions coming in. Speaking on thinning stability, I see lots of hair transplants where the patient is clearly still thinning and they have great results. If you're on meds, is minor thinning okay for a conservative hair transplant? Yeah, the meds aren't meant to restore the fullness and then you get a hair transplant. The meds are meant to more or less just stabilize, and sometimes you still get some fullness back from the meds, but they're meant for stability. Because what I don't want is to do a transplant, right? Because when you do a transplant, you do it with like all the other hairs in mind, right? You don't just like say, oh, there's a hair that might go away one day, so I'm just going to stab right through it and put a transplant. No, it doesn't work that way. So if I've got hair like this and I'm doing a transplant, I'm working around it, right? I'm going to make a recipient site, recipient site, recipient site, and in between, right? And then the grafts are going to go in there, so it's going to look fairly full once it's done if there's some pre-existing hairs. But now imagine, so now you've got, okay, these are original hairs and these are transplanted hairs, right? So you got them together, but now you're not on medical therapy, and then these hairs drift away. So now you got those like gaps back again, right? Because now all you have is your transplanted hair. So that's the concept. So the medical therapy is for those original hairs, And then the transplant is meant to augment that result. Hopefully that's pretty clear. Okay. Got a script for zero point 0.5 milligram. The questions are just, you guys are like, oh man, he's leaving. I better get my questions answered. So I'll do my best. Script for zero point 0.5 milligrams of finasteride scare due to sexual side effects. Is it worth it? Only Champ 1988 can answer that question. I get that question a lot when it comes to cosmetic surgery as well. People are like, well, you know, uh, is like, I understand the surgery, whatever, and do you think that I need this? Like, is it worth it? Is a question that sometimes I get during consultation. I can't answer that question. There's so many things that go into that, right? There's cost, right? So even for finasteride, there's cost of taking it. There's the risks of side effects, whether it's surgery or medical therapy. There's side effect risks. And then there's the potential gain that you're getting. Is that potential gain great enough, right? Is it worth the recovery from surgery? Is it worth daily having to remember to take the pill, right? Is the problem that you're treating bad enough to warrant all those risks? Only you can answer that. I can't answer that. Like, I did a video, right, about uh, Olumiant, which is the drug that came out, the JAK inhibitor for my condition, which is autoimmune, right? LP Shariata Universalis. So there's a pill that's FDA approved, right? That would be covered by my insurance that could help me potentially regrow all my hair, but I choose not to take it, right? And check out that video if you haven't seen it yet, where I kind of like talk about why. And but each person, I mean, there's plenty of people who take that pill and do great, have like no side effects. They got their hair back, they got their confidence back, and they feel great. So awesome, And the same thing with finasteride. I mean, I prescribe it almost every day to many people, and most of the patients are super happy on it. They have no side effects, and they're doing great. They then get a transplant, everything's good, people are happy. But, there's plenty of people who do develop side effects, and sometimes those side effects can take a long time to go away, especially if you've been on the medication for a while, and they can be bothersome and worrisome to people. Yeah, so you just have to kind of like think it all through and decide what might make the most sense for you. Though I usually recommend that people at least try it. If you're going to get sexual side effects, you'll see them typically within about a month of taking the medication. So you have that. Your options then are to stop it completely or to decrease the dose or the frequency of how often you take it. So I think that about wraps it up. I'm all parched, trying to talk a mile a minute here. At least this is a fast rate for me. Might not be for some people. I was watching a DeFranco video today, and I was like, "Oh my god! Like, is he fast forwarding? Is he like on 2x speed, does he just talk that fast?" So, yeah. So, yeah. Hopefully, this was helpful for you guys. We try to be as transparent as possible, both on what's happening in the practice, on our other activities, and then about these procedures and these treatments. And I'm never going to sugarcoat anything. Everything has pros and cons. If something doesn't have a con, it probably doesn't work, right? So there's always some potential negative. And so in life, I think with anything, right, it's risk reward, whether whatever, anything, right? The types of jobs we pick, the types of activities that we do. Like skydiving sounds great to me, and also, doing the cliff jumping where you glide along. I mean, that all sounds super exciting, but to me, it's not worth the risk. So everyone has to make their own risk benefit calculation for everything that we do, and then move forward. But for a lot of the stuff that I do, there's definitely some serious calculated risk. But most patients, and that's also why I looked at satisfaction rates of the surgeries that I was doing, and I was like, you know what, the stuff that I've decided to focus on now is really like, it tends to give very high satisfaction rates to people across the board, men, women. And so that factored into my decision making too. So I try not to offer surgeries that are like much more risky than they're worth. Because at the end of the day, I want to sleep well at night. I don't want to have too many complaints or have my patients be upset and stuff like that. So hopefully this is helpful. There's a lot more to come. We the growth of the channel overall has been great. We have certain months that are up, certain months that are a little bit slower. We have lots of ideas on how to keep it growing and keep the content exciting and interesting. And we just are thankful for all of you for being a part of this, and hope to see you again soon at the next live. And this is a lot of fun. So take care, you guys. And it'd be cool one day to like have actual like audio. Like if someone could send in questions and then we can respond maybe in advance and we can play the audio. So or maybe even a video. That would be fun. I'll have to talk to Marco about the logistics of that. Just so it comes to life a little more, because I just feel like I'm just talking into a screen and we've got questions, but I don't know, it'd be maybe come to life more if we saw people's faces or heard their voices about some of these questions that they have. So again, thank you guys for all the support, and we'll keep working hard for you. Take care. See you. Bye.